Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. April 13th, 2020, COVID update. First, though, big shout out to Abby Ronk, Crail, and John, and their new daughter, Caroline. Big news today, Abby's going to be coming back May 5th to the practice. The 6 of us in my particular group have missed our 7th musketeer, and so we're very excited that she'll be coming back on Tuesdays, Thursdays, and Fridays starting the first week of May. So very happy about that. A big thank you to everyone at my office for all their continued hard work. My director, Susan Campbell, Rhonda Morgan, our manager, and the entire staff who continues to work great on behalf of all our patients. And thanks to all the patients for their patience as we get through some of this COVID stuff. So what's the COVID update for today? Well, we're going to go over first the statistics. So about 1.9 million cases, a little bit over, about 120 some thousand deaths in the world. Keep in mind the death rates. There was another article about this today. Half the people who die of COVID are dying at home or at nursing homes and never get recorded. There was another report of that today, even out of New York. But that's been now from the Netherlands, Italy, multiple places in the United States. So always remember that these numbers are just reflective of hospitalized deaths. If you look at Germany, if someone comes in acutely ill with COVID, which happens relatively frequently there too, and they pass in the first 24 hours, they didn't even bother to test them. So the numbers are always going to be skewed downwards, not upwards, which is what a lot of people who don't want to believe in the event say. United States, we're about 570 some thousand cases, 23,000 deaths, slight flattening of the death rate today. And then in Oklahoma, we're over 2,000 positive cases and 99 deaths, I believe. So numbers continue to rise everywhere, but there is some flattening of the curve. Again, that means that the arc, instead of going like this, which is what we needed to stop, is now starting to do this. And if it can keep doing that, we all do better. The big fear with a big wave of COVID cases was overwhelming the healthcare system. I think we've successfully avoided that in Oklahoma, at least, and in a lot of places in the rest of the country. It took about 50 to 80% of the population to actually abide in statistical modeling to flatten the curve or shift the curve. And I can say clearly that's what we've managed to do in most of the country and in Oklahoma. There's a large percentage of people who've blown it off and haven't helped, and they'll later say, see, I didn't need to do this because not as many people died. Well, that's because all of the smart people did what needed to be done, just like the ones who actually do the vaccines, protect all the anti-vaxxers from getting sick. It's the ones who make the effort and that save the group. It's the overachievers that make the group survive, not the underachievers. So just keep that in mind. Big shout out too to Mike Turpen on Flashpoint on Sunday. He debated Kevin Lamb, the former lieutenant governor. Nice guy who I've supported. I want to be very clear in the past, both with voting for him and giving him money when he ran for governor. But it was a really interesting debate on COVID. Mike Turpen just very clearly quoted science and especially if you know Mike Turpen, he can be rather loud and kind of, out there. He just gave a very elegant summary of why the curve had flattened, which is the education of people like Larry Bookman, the OSMA president, David Chansom, the head integrist infectious disease doctor, and Casey Strum, Dr. Casey Strum from OSU, who's leading the kind of public health charge with Secretary Laughlin. And he was very clearly stated that, no, we've changed the curve in Oklahoma because of these people and all these efforts by lots of others to educate the public, and it's worked. And I think Kevin Lamb was supportive of that idea to an extent, but he wouldn't quite admit it. And then he said again, well, he compared COVID to automobile deaths and then to flu deaths. And once again, just for anyone who does that, stop. You're sounding really unintelligent because you don't understand statistics. Okay? COVID killed 23,000 people in a month in the United States, and that's with us spending billions and billions and billions of dollars and making a national effort to try to limit the death rate. In 1 month in the United States, there's about 3,000 deaths by cars, okay? And that's a disaster and it's terrible. But again, you can't compare the two. They're not the same. They're not the same. And by the end of the year, even though we flatten the curve, COVID will have killed a lot more people this year than automobile accidents because COVID is an extremely deadly virus. And that doesn't belittle car accidents, but you don't try to belittle one disease event with another. That's what a syllogistic fallacy is, just like with flu, once again saying flu kills a lot more people. For every 1,000 people that get the flu, it's 0.05 die. It's 1 for everyone who dies for COVID. So the classic number is it's about 100 per 100,000 with COVID, and it's 5 to 7 with flu. They're not comparable in terms of death rates, infectivity, or any of the morbidities associated with it. So everyone needs to stop making those false analogies, because you're just, for anyone with a brain, you sound like an idiot. So please stop. And that's how it is. So let's talk about some good news. Other good news, the curve is flattening. The curve's flattening because of people's great efforts. We're not going to run out of ventilators, and that's a two-part process. One, people are being treated earlier with Plaquenil all throughout the country, including in Oklahoma, as when they get exposed or when they first get sick. That's going to markedly decrease the number of sick people, because if we decrease the number of people getting really sick, they don't go into a cytokine storm, which is when all your inflammation speeds up, and then you end up with unbelievable respiratory failure. But the ventilators really don't help anyway, because part of the hypoxia is your red blood cells aren't working, which I've talked about. So you put bad lungs with organ failure from low oxygen in the bloodstream itself, from not having red blood cells that carry oxygen. The ventilators really don't help, and by the time you go on a ventilator, you're probably going to die 4 out of 5 times to 95% of the time, or 96% of the time. So the length of time on a ventilator, instead of being 14 days, ends up being 3 because of the rather abrupt death rates. So the bottom line is, we're shifting to the earlier phase successfully, and so that's helping with the number of people who will die in our country, which is one of the things I theorized about 4 weeks ago when they were first saying, or 3 weeks ago, that potentially 254,000 people would die. I felt very strongly that was incorrect, because 1, we understood the disease better. 2, we were going to socially distance better than what they were predicting. And 3rd, the Plaquenil use, along with melatonin use and some of the other things that people have started, we're going to kick in across the country, because people have become aware of zinc and melatonin and Plaquenil. And I think that's being proven out. So all very good news for the country. I think overall, if we really work on social distancing, sheltering in place, washing our hands, wearing masks, the curve will really flatten out, and I think we'll be in good shape for a major change, hopefully by around May 1st. In some parts of the country, maybe most parts of the country, perhaps Oklahoma, I'm very optimistic about. We'll then have to follow guidelines in terms of washing our hands, still keeping social distance, but allowing more flexibility with what we're doing. And then, of course, masks. Part of this will be testing. We're still forever and a day away from having rapid testing readily available across the country, but maybe within 3 to 4 weeks. And that may not seem that long, but it's relatively long when you're in this situation. Likewise, do not waste your time by getting serum antibody testing right now. It's completely meaningless. If it comes back positive, you don't know if it was positive for a coronavirus or COVID-19. That's been clearly established. There is not definitive serum testing. If there was, I would be promoting it. Everyone would be promoting it. We have to wait at least another 2 months, maybe 3, maybe it'll be sooner. But right now it is a waste of money, and you don't want to spend it, and you don't want to depend on it. Eventually we'll have it. We just have to be patient. So that's the main points of this evening's review. We're flattening the curve. We got to stay on track for it. 2, Mike Turpen killed it, and Flashpoint sounded great. Really appreciate him supporting the medical community and not supporting some of the things that Kevin Lamb said. Again, a good guy, but some of the stuff he said was just wrong, and some of it by inferring that the hospitals were giving making money on the COVID thing is insane. And just to highlight that, Mayo Clinic is looking at about $1 billion loss this year. It will be a miracle if they don't go bankrupt. MD Anderson's getting killed. Integris has furloughed a huge percentage of their administrators and cut salaries across the whole system because they're getting so killed financially. So, and it's the same at Saints, it's the same at OU. This is a disaster for the healthcare system. Think about all the doctors who aren't doing anything because they have surgical practices. And so their staff, them, nothing to do. It's a disaster financially for the healthcare system. No one's making money on COVID, Kevin. So don't say that again or infer it. It's offensive. Again, I like him. It's just that was wrong. So that's the big summary. Be well, be safe, and I'll update you tomorrow.